Hi, so we're going to continue with the assessment, the physical examination, and I will be checking her ear. So I'm checking the ear for any tenderness, any swelling, any pain. And I'm going to look inside the ear to see if there's any drainage in the ear. Any tenderness, any pain, any symmetry. So I just checked, I just assessed the ear, and there's no mass, no lesions, no discharges, no lumps or tenderness to palpation. The ear canal is clear. Tympanic membrane is pearly gray with landmarks intact. No perforations noted. I'm going to whisper into your ear and see if you can hear me. I'm going to whisper into this ear. Okay, so I just whispered into her ears and she can hear me bilaterally. Now I'm going to be checking her nose. So I'm going to check the nose for any deformity. There's no deformity. There's no sinus tenderness. And I'm going to check the nerves to check for any drainage or any signs of tenderness. There's no, the nostrils are patent, nasal mucosa is pink and no lesions. Septum is in the midline, and the sinus, and no sinus tenderness noted. I'll be checking the mouth. I'm checking the tonsils, I'm checking the mucous membrane, and can you stick your tongue out, lift it up? Okay, so I just checked the mucous membrane is pink, there's no lesions or bleeding. Tongue is in symmetry, it protrudes in the midline. The pharynx is also pink, no drainage. The uvula rises in the midline on phonation, and the tonsils are 1+. So right now I'm going to be checking the neck. So I'm checking her neck for symmetry, and for range of motion is within normal limits, no problems. There's no mass around that area. Are you having any pain? There's no tenderness. Patient denies any pain. And I'm going to be checking the trachea. So the trachea is in the midline, and also I'll be palpating the thyroid. It's non-palpable, non-tender, and the jugular vein is 45 degrees, as well as the carotid arteries are 2+, equal bilaterally. Okay, now I'll be checking the thorax. So with the thorax, I'll be listening to the lungs and the chest. Okay, so I just checked the thorax. Chest expansion is in symmetry, is symmetrical in order, and the lung sounds are clear to auscultate anteriorly and posteriorly. There's no severe tenderness noted. I'll be checking the heart also. abnormal pulsation noted. The apical pulse at the fifth intercostal space. There's no trills. S1 and S2. It's not diminished. S1 and S2 is not diminished. There's no murmurs, no rubs, no clicks or gallops during auscultation. I'll be checking the abdomen. So I'll palpate the abdomen. Okay. And listen to the bowel sounds. The abdomen is flat and symmetric. Skin is smooth with no lesions or scars. Bowel sounds are active times 4 quadrants. There's no bruit noted on auscultation. Abdomen is soft, no mass or tenderness voiced. Okay, and I'll be checking the extremities. Okay, I'll be checking the upper and lower extremities. Okay, the extremities were checked for color, and the color is normal for her race. There's no tenderness noted, and there's no lesions as well, no edema. There's no calf tenderness. All peripheral pulses are present, 2+ and equal bilaterally. Now I'll ask the patient to move the entire body to check musculoskeletal to do a musculoskeletal examination. So if you can walk around and move, please.
Oh.
Movement, move your arms and okay. You can extend and okay. So patient, there's no slipping or crepitation noted. There's no slipping or crepitation noted. Patient is able to move the entire body, flex and extend. No vertebral pain, complaint of vertebral column is noted with no deformities. Full extension and flexion noted. So this will be the end of our examination. Thank you, Miss Seal.
You're welcome.